Hello, everyone, and welcome to our YouTube channel with our first segment being building a consistent exercise routine that actually sticks. My name is Kaylee Kerr. I'm an occupational therapy student at Complete Cancer Rehab, and I'm excited to present the information to you guys on this subject. So let's talk about the outline for today's video. First, we're going to start off talking about the benefits of exercise. We know it brings a lot to us, but it's always nice to revisit it and kind of see all the amazing benefits exercise can bring to us. Then we're going to talk about the barriers to consistency. So what we are seeing within our community are often barriers to staying consistent to the routines that we create for exercising. Then we're going to talk about the steps to create a routine that's individualized to you, that it is often more motivating, right? Then we're going to talk about tips and tricks to stay consistent once we create that exercise routine. All right, so I wanted to start off with a brief introduction because you're going to be seeing my face a lot on the YouTube channel as well as some others. My name is Kaylee Kerr. I'm an occupational therapy student at Creighton University, and I'm completing my doctoral capstone at Complete Cancer Rehab. Complete Cancer Rehab is a clinic based in Littleton, Colorado that focuses on empowering patients through their cancer and lymphedema journey. Our goal with this YouTube channel is to broaden our horizons and reach out to cancer patients all over the world and create a community. And if you're interested, Complete Cancer Rehab has occupational therapy, physical therapy, personal training, bunch of different services for you. So feel free to visit our website, send us an email, call us. We would love to connect. So I'm excited to present. Thank you for being here, and let's get started. All right, let's start out with your time to shine. So I wanted to start the segment just with the poll. So what you're gonna do is you're gonna scan the QR code with your phone camera, and it should bring you to a link. If not, you can also copy the link I have on the slide into your search bar. And it's just a poll asking how you feel about creating an exercise routine. Once you answer, it should also show you the answers that people in your community are also saying. So it's kind of fun to connect and see what everyone's kind of feeling like with this subject. So go ahead and answer if you want, and then come on back to the video. And I'm excited to see what everyone has to say about this subject. All right. Let's start with why exercise matters. So, regular exercise boosts our energy, our mental health, and our overall well being. It's also seen to reduce risk of cancer, chronic diseases, and different age related health issues. It also helps manage our daily roles and provides a sense of achievement to us. So, one, exercise gives us a lot of energy and confidence to go about of our day. So, oftentimes it allows us to be able to complete our daily roles better and more efficiently. It also provides a sense of achievement. They always say you never regret doing an exercise, which is so true. It may be hard to get there, may be hard to get through it, but once it's done, most of the time we're never like, oh, I regret doing that, right? We feel better, or we just feel a sense of achievement. A lot of the studies that I focused on in this video are studies that focused on what are the perceived barriers that cancer patients are seeing when it comes to exercise, and what do they prefer. So these studies interviewed a bunch of different cancer patients and got their perceptions on this, which I feel like is a super nice thing to have because individuals with cancer are obviously going through different roles and routines and also experiencing different symptoms with those who compared to those who don't have cancer, right? So, what these studies showed is post radiation, exercise increased bone density and muscle mass, which is super important when going through a cancer diagnosis and as well as treatment, because treatment is hard on our bodies. It also targeted in a positive way cancer related comorbidities. So, comorbidities is another word for symptoms. So, people saw improvements in their pain, fatigue, and lymphedema. So, overall, exercise had a very positive benefit um, on those experiencing cancer. So, like I mentioned before, the study that I kind of focused on was the adherence to physical exercise programs in patients with breast cancer. So, what the study did is they interviewed a bunch of different individuals experiencing breast cancer and asked them, what are some barriers that you're seeing and experiencing? So, some physical barriers that were reported were neuropathy, fatigue, pain, and lymphedema. So, these are physical barriers that are preventing individuals from adhering to an exercise routine. Psychosocial barriers, so this is basically our mental health. Um, they reported decreased self-discipline and motivation, as well as lack of companionship and confidence. They also found reduced enjoyment when it came to exercise and fear of injury. Lastly, they reported on environmental barriers. So these are barriers within our environment that prevent us from adhering to exercise programs. So cost and safety concerns was one, time constraints and competing responsibilities. This one is seen a lot with individuals all over. We have all these different responsibilities. Sometimes it can be hard to put ourselves first in exercise. Reluctance to use facilities, so kind of just that anxiety or not wanting to use local gyms or go to local studios, stuff like that. Driving distance and traffic. Traffic's a real thing in Colorado. We have a lot of it, I'm sure as elsewhere. So I can see how this can be a barrier. Lack of knowledge or information about exercise and insufficient equipment. Oops. All right. So, those are kind of the barriers that we're seeing. Now, let's talk about steps to creating a routine, an exercise routine that's individualized to you and that can be motivating and that you're more likely to adhere to. All right. So, step one, decide when you will work out, right? All of us have different preferences on the time of day we want to work out, but also we have competing roles and responsibilities in our lives that not everyone can work out in the morning or the evening or the night because there's things that we have to do. So, this is where you think of yourself and what's best for you, right? Should I work out in the morning, in the evening, in the night? In studies, physical activity preference among cancer survivors, a lot of individuals preferred those morning classes, which makes sense because in the morning, a lot of the times we have the most energy compared to the evening. So, figuring out based on your energy levels and your roles and responsibilities, what time of day you're going to work out. So, that's the first step. Then decide the frequency you're going to work out per week, right? So, current exercise guidelines for healthy adults, they suggest engaging in exercise 3 times a week. And in studies on for individuals with cancer, a lot of those who experienced it preferred to work out 3 days a week. So, hitting that exercise minimum that they suggest. So, opening your calendar and fitting your exercises into your daily life is a great way to stay consistent in creating your exercise routine. So, for example, you may want to work out Monday, Wednesday, Friday in the mornings. Like I said, this varies based on your preferences, but just getting it into your calendar and staying consistent with it is a great way to build your exercise routine. All right. Now, what's your preferred exercise delivery? So I kind of categorize this into three different categories. Obviously, there can be more, but this is kind of a helpful way to look at what your preferred exercise delivery is. So the first one is group-based classes. So this is obviously you're doing classes with groups of people, or you can see this as maybe doing exercises with like a partner, a spouse, any other individual that you can have that social support from, right? In multiple studies, a lot of individuals with cancer really liked the group setting because it boosted their support, increased their motivation. It's nice to be around individuals who are going through something similar as them. And it also just increased motivation, which is a double win, right? But that could be not for everyone. So trying out a group-based class and seeing if you like it could be a great opportunity. This next category, unsupervised self-paced exercise programs. So for me, I look at this as kind of doing exercises on your own and on your own time. And this is also a great option for people who have conflicting roles and responsibilities. So you could go onto platform-based exercise videos. So, for example, YouTube has millions of videos of all different types of exercises that you can search up on your own time. This also could just be building an exercise routine directed by you. So you go to the gym and you have a plan that you put in stone for yourself. So that's kind of what I mean by unsupervised self-paced exercise programs. The third category is supervised exercise programs. So this is exercise in a company of a professional, right? So those who prefer this type mentioned it was more motivating, accountable, and it was just comforting to be around a professional. Sometimes it's nice, especially if you have that lack of knowledge or fear of injury, to be around someone that knows exercise in and out and can kind of tailor it to you. So a lot of individuals experiencing cancer liked this group of opportunity, and it also just was a great way to socialize, just like the group-based class. So these are all different types of exercise delivery. Trying them all out, seeing what fits best for you and your lifestyle is another step to creating your exercise routine. All right, this one is important. So, what type of exercise works for you? So, basically, this is trial and error, right? You're going to try different exercises and you're going to do something that you enjoy. Um, so, I kind of wanted to break down exercise into three categories: endurance, strength, flexibility, and balance. So, with different exercises that we choose, we actually oftentimes hit all three of these, but it's kind of nice to break them down to understand what exercise is bringing to us, right? So the first category is endurance. So endurance is increasing your heart rate of any type of activity, right? So this can be walking, yard work, swimming, biking. For me, sometimes it's just going up the stairs, right? You get your heart rate up. That's what endurance is bringing to us. In the same study, walking was the most preferred physical activity among individuals with cancer. So, in multiple studies, they found that walking was a great source of exercise for these individuals. Now, moving on to strength. So, strength is increasing your muscle strength of some caliber. So, this could be weight training, resistance training, um, different. You can do weight training without equipment, but the most common known is using weights, right? Weight training has very positive benefits within the cancer community. In a study focusing on cancer related fatigue, um, resistance based training, which is strength training, helped combat fatigue and improve quality of life, particularly in role and social functioning. So that's awesome. And this is also a preferred form, just like walking, of exercise among cancer survivors. Last, flexibility and balance. So, balance obviously is our ability to stay stable within our center of gravity, and flexibility is increasing range of motion. So, some activities that target this is stretching, yoga, Tai Chi, and supported balance challenges. What I mean by supported balance challenges is having a chair. This is an example: having a chair and maybe standing on one foot, but you're having that support still. Um, so these are all the different types of exercises. So, piggybacking off that previous slide, finding an exercise that you like is the most important step for creating a routine and staying consistent with it. Like I said, this could be trial and error, or you might find it like right away, right? So, these pictures show an individual in the pool doing pool aerobic exercises, or yoga, or chair seated exercises. The picture in the bottom middle is Tai Chi, which is a common balance and flexibility endurance challenge. Or you could just be getting outside in nature. Especially in Colorado, we have the amazing mountains that we can bike, we can go hiking, we can walk in. Just being in nature not only improves you physically, but also mentally, right? That nature component is very therapeutic to a lot of people. So, finding what works for you. All right. Now that we talked about creating an exercise routine, let's talk about tips and tricks to stay consistent now that we have that routine, right? First thing, make a plan. So fitting your workouts into your schedule and prioritizing them. I kind of mentioned this earlier. If you have it down in your calendar and you make it a priority, that's a great way to stay consistent with your goals. Next is setting clear goals and intentions. So, first, knowing your why. Having the why in your head is a great motivator to stay consistent, whether it's to feel better, whether it's to gain muscle strength, whether it's to have a sense of community or lose weight. Having that goal in your mind and your intention is so motivating. Next is setting that realistic goal and gradually getting more difficult as you meet your goals. A lot of times, a big mistake that happens is individuals will set goals that are just not realistic, and then that makes it less motivating and makes us give up, right? Um, for me, running 3 days a week, not a good goal for me because I don't like running, right? I don't wanna run. So setting a goal, even if it's just getting up and going to an exercise once a week, that's a good goal and it's realistic for some individuals, right? And then as you meet those goals, gradually get more difficult and more consistent with those goals. All right, next, track your progress. So, this can be very motivating if you track your progress and see how far you've come. This can be through a journal, or there's a bunch of fitness apps to help keep motivation up. For me, I use my Apple Watch as motivation. There's three little activity rings that are through an extra app on my watch. And as I exercise more, as I get moving more, the rings slowly close and for me, the motivation there is getting those rings closed. So that's just an example um, of how it can be motivating. Next, create a reward system. I love this one because when we reach a goal, we deserve a reward, right? So maybe if you reach an exercise goal, you can go on a date night or you can have a special snack. Creating a reward system is super motivating and it's just a great way to track your goals. Next, do activities you enjoy. I've said this a lot, but I think this is one of the most important ones. Finding a workout you like increases your motivation and adherence, right? Like I mentioned previously, I don't like running, not my thing. I wouldn't do it if I made that my main um, area of exercise. So find something you like and really enjoy, and it will make you more likely to adhere to your exercise routines. Lastly, build a support system. So surround yourself with supportive friends and family to help you reach goals. Whether this is a workout partner or a spouse or a friend, just checking in on you to make sure you're doing great with your workout routine. Building a supportive system is proven to be very motivating. All right. This might be one of the most important slides here, but you know your body best. Please listen to it. So, before you start any exercise program, it is super important to consult with a healthcare professional to ensure that exercise is safe and appropriate for your specific health condition. So, please, if you are curious or just like want to know for sure if this is a safe means of exercise for you, please reach out to your healthcare professional and ask. Another disclaimer, when you are working out, always listen to your body during an exercise. If you experience pain, discomfort, or unusual symptoms, that's not normal. Stop immediately and consult your healthcare provider again on the type of exercise you are doing, right? So, like I said, most important slide, we want to be safe, but we also want you to help you reach your goals. Okay, that sounds good. All right, so that is the end of this video. Thank you again for being here. This is our first YouTube segment, and we're excited to continue and build our community and provide resources to individuals experiencing cancer and lymphedema. Um, if you have any questions, we would love to connect with you. So we are here for you. Follow us on Facebook, Instagram, subscribe to our YouTube. Also visit our website and visit our forum. So our website has a lot of information about us as a company, and our forum is a great way to connect via blog system with other individuals who have experienced cancer or are survivors, all the things. It's a great resource. Please use it. Lastly, our LinkTree. If you aren't familiar with LinkTree, you basically put that link on the slide into your search bar, and it will bring you to a website that has all of our connections that you can just click on them, and it'll bring you right to our YouTube channel, right to our Facebook. It's just an easier way to get to our services we have in place for you. So thank you again. Here are my references, and I look forward to sharing more and building our community here on the Complete Cancer Rehab YouTube page. Thank you.